Hello, my name is Dr. Sierra Richard. I am currently a clinical pharmacist specialist in investigational drug service and a board certified pediatric pharmacy specialist. And today I wanted to walk through a common type of question that you're going to see on the NAPLEX and give you some insight on how to work through those. Because I am involved in research, I thought it would be a great opportunity to go over something that focuses on clinical trial design. So the question I have for you up on the screen, I'm going to read it to you and we're going to sort through what information is important to answer the question, what information is not, and how to decide which of these answers might be a viable option. So the question reads, you are a clinical pharmacist specialist working at a large urban medical center in Las Vegas. You have finished your postgraduate year 2 training in infectious diseases, go you, and you are proud to be working as an infectious disease specialist who participates in rounds. Today you get a report from nursing staff that a new antibiotic, Kilbugza, quite the name, which you recently recommended to a patient, caused the patient to go into a life-threatening arrhythmia just moments after the first infusion started. After thorough review of the package and certain information available from Lexicomp, you determine that this drug has been associated with precipitating arrhythmias in approximately 0.5% of patients. With this information, as a new practitioner hoping to establish and maintain credibility, you make it your mission to investigate how other medical teams have managed this adverse reaction to Kilbugza. The information you are seeking would most likely be located in which of the following types of clinical trial. So you get these paragraphs that have a lot of information that you need, and there's also a lot of information you don't. So let's go through the information you need by going through this again. So I really don't need to know where you're at or that you just finished your PGY2 in infectious disease, but you do need to know that the patient did go into a life-threatening arrhythmia. So that is an important part of what you're looking at, and that this drug has been associated with arrhythmias in the past. So that means this is something of a pattern, but a small amount of patients have this, 0.5%, that's pretty rare. And with the information, what you're trying to do is investigate how other medical teams have managed this adverse reaction. So what information you need is going to be located in what type of clinical trial? That is the question you're really answering, the type of clinical trial that you're going to find the information you're looking for, which is how to manage the adverse effect. So the first is a systemic review, and systemic reviews, think of them oftentimes as a way to gather information for series of events or types of studies that just don't have a lot of information or don't have a lot of patients, so it might be hard for a single study to get the information that you need. So you gather information from multiple different studies, put it together, and that's kind of the systemic review. So in this case, with this being a rare disease, it doesn't seem likely that that's the type of review you're going to need. So we'll leave it open, but we'll move to see if there's better ones. So next is a case control study. And so when I think of case control studies, I think of somebody having a reaction versus somebody not having a reaction. So the case is the type of adverse event that is happening, and then your control is a person who doesn't have that event. Because of the rarity of this adverse event, these arrhythmias are only happening in 0.5% of patients, a case control study wouldn't work, and it's also not going to answer your question because you're trying to figure out how people are managing the adverse reactions, whereas this would just compare the people who are having a reaction to other people, but not necessarily how we're going to manage the adverse reaction. So in this case, we're just going to cross through case control study. Next, we have a randomized control trial. So this is your standard drug trial that you think about when you think of a clinical trial. This is your placebo-controlled trial. This is where we randomize patients into different groups, and you might find the rate of an adverse event, so this 0.5% of patients having an arrhythmia, probably came from a clinical trial setting. So it would tell us where the event is happening or how often the event is happening, but it is not going to tell us how to manage the adverse event itself. So I'm going to cross through that one as well. The next option is a case series. And so this is where multiple people report a case, and you can see how different places manage that same case. So this could be a good place to find information on how arrhythmias were managed in this type of medication reaction. And the reason for that is these are very rare, so we're not going to see a lot of them. We're not going to see enough for that systemic review. So I'm going to go ahead and cross that off the list because that seems even less likely. That we're not going to find enough that there's going to be large reviews or even small reviews done on multiple patients having this reaction. And with a case series, we're basically going to be able to look at individual cases and how the arrhythmias were managed with those cases. So this seems like a really viable option for us. Next is a pre and post study. And this is where you do an intervention and you look at how people react before and how people react after. And we're not looking to give this person a drug and get an arrhythmia, right? We're trying to treat an infection. But with a pre and post study, we would be trying to basically induce the reaction if that's how we were going to look at it. And it's also still not going to answer that question of how to manage that adverse reaction if it happens. So I'm going to cross this one off, and it seems most likely that the answer is a case series. So that's the answer I'm going to select. And then we're going to go up here and hit end and review and see if we got it right. So we did get this right. We're going to review the question. So one of the things that I really like about TrueLearn's test bank is the comprehensive answers and explanations that it gives. So I like the bottom line because if you got it right, this is just all you really need to read unless you really guessed on the question. So the bottom line here is a case series that would be the best type of clinical trial in which to find information on rare adverse events and how to control them medically. This type of medical literature typically encompasses such information as the presentation of the event, precipitating factors, and how the situation was resolved, which is what I was saying. We're more likely going to see a walkthrough of the entire case and what they did to resolve it. So I like the different answers here where you're trying to find what type of information would be best. And so the explanation talks about this is the kind of thing that sometimes pharmacists have to do. We get drug information questions all the time, and we do need to find what type of study is going to work best for this. So systemic reviews, it talks about them combining the statistical information from multiple primary sources in order to get one conclusion. And so, as they mentioned here, systemic reviews will rarely talk about these adverse events that are extremely rare like this. That's not what's really going to be looked at. And the other thing is, these are also really time-consuming reviews to do. So you're not going to see somebody looking at a extremely rare reaction like this. So case control studies, and we talked about this as well, compare individuals with an outcome to other individuals without the outcome. And so because this is so rare, it's unlikely we're going to be having enough patients to do this kind of study. Next is a randomized controlled trial, and it might support the conclusion that there's an adverse reaction. We mentioned that, but it's not going to talk about what to do if that happens. And then the reason E is not correct is the pre and post study looks at endpoint measures before an intervention and compares it to one with measures after the intervention. And so we're not going to find information about adverse drug events in this type of study. So the other thing I enjoy after reading through this is that there are really good resources available here. You can also see the topic down here. So if you're missing a lot of questions in this particular topic, you're going to be aware of that. And what categories it falls under as well. So when you're studying, you're going to know what categories maybe you need to brush up on before your exam. I hope this walkthrough question gave you a little bit better understanding of how to review questions as you prepare for your NAPLEX. I wish you the best of luck as you prepare for your exam.